Welcome to the most frequently asked questions about how to eliminate back pain, neck pain, and sciatica. Our goal is to provide useful information exclusively for people looking for quick and easy ways to eliminate their back pain, neck pain, or sciatica and prevent the problem from returning. Hopefully, the answers to these questions will provide some insight into your particular problem. If not, feel free to contact us to arrange a free telephone consultation with one of our spine care specialists. So with that brief introduction, let's get to the questions.
Question number 10, and the most frequently asked questions about back pain is, will decompression therapy help my sciatica or back pain? First of all, decompression therapy, or spinal decompression, as you may hear it called, is nothing really new. In the old days, we simply called it traction, and it's been around for a few thousand years as a means of treating the spine. What is new, however, is how it's marketed. Now, here's what you should really know. First, spinal decompression can help alleviate symptoms by reducing the pressure on the disc, assuming, of course, that the disc is the source of the problem. Secondly, it's very expensive, and most insurance doesn't cover the cost. It's not unusual for a spinal decompression regimen to run between $4,000 and $5,000 for 18 to 20 sessions. And then finally, and I think this is the most important concept as part of this answer, is that while most spinal decompression advertisements boast of an 85% success rate, there was an interesting study that came out that suggests that you can get the same results by just lying down on your back and really doing nothing. In this study, there were two groups. One group actually had spinal decompression, where about 50% of the patient's body weight was applied to their lower back to provide some separation. And then group two was a group that was just told they were getting spinal decompression, and virtually no pull was imparted onto the spine. So we have one group with 50% of their body weight being pulled, and then the other group with virtually nothing happening to them whatsoever. After the course of the decompression, the 18 to 20 visits, a follow-up test was done to determine pain reduction. Interestingly enough, the amount of pain reduction in both groups was identical. No difference between the group that had spinal decompression and the group that did not have spinal decompression. So what was the difference? Well, the difference was, and the reason for these results was the fact that the people that were not getting spinal decompression were laying down in a position where they were allowing their back to rest for a particular bit of time. And actually, that results in some hydration of the disc anyway, which increases the disc height, which further adds to some separation. So, although I like the idea of spinal decompression, you've got to be aware of the marketing that's taking place, plus the fact that it may not be as effective as we once thought. And it's certainly not a panacea for treatment for any type of sciatica or back pain. But when spinal decompression is combined with the appropriate patient education and a targeted medical exercise program and spinal bracing, you now have the tools you need for long-term health of your spine. So still, it's not clear as to whether or not decompression has any benefit whatsoever. What is clear is that we do know without a doubt that exercise and staying active is the key.
I hope the answers to these questions gave you a little more insight about your particular back pain or neck pain situation. If not, you can schedule a free telephone consultation to discuss your specific condition with one of our spine care specialists by visiting our website at www.backpainreliefsecrets.com. On behalf of the entire Back Pain Relief Secrets team, we'd like to wish you all good health, and we do hope our paths cross soon.